The County Council is reviewing how much people receiving care services should contribute towards the cost of social care. As part of this, we want to know what you think, as this will help us to decide what changes to make.
The current system isn't able to meet the demand. We have to look at new ways of doing it. Demand will increase dramatically over the next 20 years. It can't continue the way it is. People are living longer. People are living longer with complex needs, with disabilities. We have to make sure that we can still provide the services going forwards to make sure we support those people. The current system is unsustainable in many ways. The number one priority is to make sure that we have good quality services in place for the future so that those that need support actually get it. Over many years, this has been put off. It's been made piecemeal, which means that one part of the system's fair, another part of the system isn't. We're doing it now to make sure that we can prepare ourselves for good quality services over the next 10 years, because the number one priority is supporting those that need it. This is an issue across our country, across Staffordshire, across the world actually. This has been an ongoing issue that hasn't been tackled in Staffordshire for many, many years. Many other parts of our country have tackled this. It needs to be affordable, it needs to be fair, and it needs to be simple to understand. The new proposals, I think, will make a much fairer system. We will be asking those with substantial savings or significant income to pay that bit more. But this is about protecting services for the future. It's about making sure that over the next 10 years we can look after and support the enormous demand in complex needs, people coming through with learning disabilities and mental health issues. The majority will be unaffected. They won't pay any more. %20 of people will pay £15 a week more, and the few remaining people will pay no more than £40, but no more per week in the first year. In some areas we will be investing more money. Reablement, which is helping people on their feet after a crisis, will double the free time available now to 12 weeks from 6 weeks. I absolutely acknowledge that it is people with savings, people with larger incomes, who will actually pay more under these proposals. It's about staying in your own home if you can. It's about maintaining as normal lifestyle as your circumstances for health allow. We want to provide support. We want to provide the services that allow people to live the lives they've always lived. We're putting investment into reablement. It prevents, in many, many cases, the need for long-term residential care. It gets people back on their feet, back in normal lives, and we're doubling the investment in that. We're providing 12 weeks for free instead of the current 6 weeks. Very, very important. We've been working on this for 12 months now. We've looked at other alternatives. We could ask the council taxpayer for big increases. We're not going to do that. We could actually start withdrawing services and cutting services. We're not going to do that because it's vital for people's lives. What we believe is right is to go for a partnership in care. We will ask individuals who can afford it for a little bit more. We can provide better services, and we can provide services that will support people to stay independent, stay in their own homes. That's the future. We've got to do that for the next 10 years. We've got to make this sustainable, and I believe that the proposals that we've laid down achieve that. This consultation is around making sure that we are prepared for the next 10 years. The increasing demand, it's to make sure that we can continue to provide good quality services to those who need it. It's about ensuring that we've got a system which is fair and affordable to all. So I would encourage anybody, whether they receive services or whether actually as a taxpayer or council taxpayer they pay for the services, to take advantage of this consultation and tell us what you think.